Hi, I'm Dr. Noureen Hemani. I am a senior practicing dentist, practicing dentistry since 14 years. And in my practice, I have a lot of patients who have this fear in their mind, when they're considering teeth cleaning. And sometimes they are not even considering it, but their own dentist, advises teeth cleaning. And they have all these fears in their mind and all these misconceptions about teeth cleaning. So I just thought that today through this video I'm going to help clear some of those myths and misconceptions and help you make a better choice. So teeth cleaning, what is teeth cleaning? And there are so many other questions related to teeth cleaning, so let's go one question at a time. So the common question is, what exactly is teeth cleaning? Okay, so teeth cleaning basically is done so that we can make your gums stronger, and your gums can stay stronger for a long time, and your teeth obviously are held up by the bone and the gums around. So if your gums and your teeth are strong, your teeth are going to stay in your mouth for a longer time. And so teeth cleaning is extremely important. It's just like we get our we take care of our skin, and we take care of our body by doing exercises. We take care of our skin by doing skin facials. So that's basically to maintain a good quality skin or a good quality body. And similarly, we want to maintain good quality gums so that our teeth can be protected within those gums, and that is why teeth cleaning is extremely important. The other question that people generally have is, and this is the most common question that most patients ask most dentists, is that will my teeth become loose after cleaning? So let me tell you that cleaning is done by the use of a very mild vibrator. So it's so mild that it cannot even cut through skin. So teeth are extremely hard. So basically what we do in cleaning is that we take away all the tartar, or there are these hard deposits that are formed around your tooth over a period of time, which do not go out by toothbrushing. So we basically clean all that off, because that you cannot do at home with your regular brushing. You need to go to a dentist so that we can take all of that. It's like a ring of dirt that forms around the tooth. We clean that up. Okay, so we are not doing anything to your tooth, so there is no way that your teeth can become loose after cleaning. Now, why do people, so people generally have this question, and not one but many people have this question. So why did this question arise that teeth become loose after cleaning? So what happens is, a lot of people do not get their cleaning done for many years. Now what happens is that this dirt layer that is forming around your tooth goes on increasing over a period of time. Now after some years, what happens is that that layer of dirt is kind of connected to each other, okay, and it is so strong, and the bone and the gums have already kind of depleted, gone down, and now suddenly one fine day at that stage, if somebody considers cleaning when the oral hygiene has already crossed that stage, then that time when the layer, now it so happens that the teeth are now held up by that layer of dirt, and the bone and the gums is already gone inside. The moment that layer either breaks on its own or it is cleaned by a dentist, the teeth start becoming loose. That's why you feel that my teeth have become loose after cleaning, when that's not the case at all. The bone and the gums have already gone down if you do cleaning after it has become so worse. But for regular people who get their cleaning done regularly, nothing like this ever happens. Now coming to another question is that people feel ki by doing cleaning my teeth become weak, or they become thin, or some people even say my enamel goes away. So this is one more common question that we face. Let me tell you, as I mentioned earlier also, that we use a very mild vibrator. It's not a drill, it's a mild vibrator that has no capacity to cut off any portion of your tooth. It just vibrates and removes the dirt layer on top of your tooth surface. It's a very gentle instrument, causes no pain, it's painless, and it takes away only that dirt which is deposited on top of your tooth. It does nothing to your tooth. All right, so that's the other question and another myth that people have. So let me tell you, teeth cleaning is extremely safe and it does not take away from your enamel at all. It does not make your teeth thin, it does not make your teeth weak. Coming to another question which people generally feel is that when I get my cleaning done, my teeth start feeling very rough. So why is that so? So now what happens is your tongue is now used to that layer of dirt which has got deposited over so many years. Now suddenly when we take off that layer of dirt, in one sitting some of it may remain on the tooth surface, or the vibrator that we use may cause some kind of a roughness which gradually weans off in 1 or 2 days. But now that your tongue has been used to that one particular layer and now that layer is off, so 1 or 2 days your tongue feels different, it starts feeling rough, the tooth surface, but later on you get used to that feeling. So teeth cleaning basically removes that layer out, and so that roughness may stay, but generally teeth cleaning is done in 1 or 2 sittings, after which there is a process which is called as polishing. So whatever roughness has been felt by you, or the roughness that your tongue feels, is polished off. Okay, so that's what is done after teeth cleaning. Another question that people generally ask is that how many visits or how many sittings will cleaning have? So it all depends on how much of deposits are there on your tooth, how many stains are there, because for people who have excessive tea, coffee, also those who smoke or consume any form of tobacco may have additional stains on their teeth. So teeth cleaning basically in one sitting we work up to 20 to 25 minutes, because more than that becomes very tiring for the patient. So sometimes there may be 2 or 3 sittings depending on the condition of your tooth. So from 1 to 3 or 4 sittings is what you may require to visit your dentist for. So that's about the number of visits. Another important question is, generally when people get their teeth cleaning done, suddenly they have this misconception that suddenly after cleaning my teeth are going to look white. So let me tell you that teeth cleaning is not equivalent to teeth whitening. Teeth cleaning is more for the health of your gums, it is more for the health of your teeth, and it is more of therapy for your gums, so that your gums can stay strong, the bone around your tooth can stay strong, and whatever deposits are there. So suppose someone's teeth have started looking brown because of tea coffee stains, or because of tobacco stains, or because of pan stains, then they are going to see a difference in the color, because we don't change the base color of the tooth, but whatever is deposited on the tooth is cleaned off in teeth cleaning. So yes, the teeth look brighter, but there is no change as such in the color of the tooth. If you want to do that, there is a separate procedure which is called as teeth whitening, for which I will create a video later on, but teeth cleaning is more for the gum health and for your tooth health. Now, who is an eligible candidate for teeth cleaning? Let me tell you, teeth cleaning is an absolute must for each and every individual, because if you want your gums to stay strong, now these deposits are there on everybody's teeth. Okay, what happens is basically your saliva has calcium. Now whatever food particles are deposit on your tooth, the calcium in your saliva binds with these food particles and makes these hard stone like deposits on your tooth, especially in the lower inside teeth. Even if you look in the mirror, you will be able to see it. So that is something that is required to be cleaned up professionally by a dentist, and everybody has that. It is more prominent in cases where the teeth are not aligned properly, if they are crooked, because it's a simple logic, that if your teeth are straight, the brush reaches at all places, you are able to keep it clean. If your teeth are a little not aligned properly, your brush cannot reach at certain places, and so there is more food deposition there, so there is more of those hard deposits which we call tartar. So obviously you are going to require cleaning more frequently. So cleaning is required for everybody. There are no selected candidates for teeth cleaning, but yes, it's also important to understand how frequently should teeth cleaning be done. So teeth cleaning ideally should be done once in 1 year, but in cases where I said like there is an alignment issue and the deposits come back too often, it may be done once in 6 months, but once in a year is ideal for most people. And then obviously when you go to your dentist and you get yourself checked, they'll be able to tell you whether you require cleaning sooner than a year, but once a year is what is recommended. Now, so these are basically the questions that people generally have when they consider teeth cleaning. Apart from this, I'd also like to tell you that you must visit your dentist once a year for your routine checkup and your cleaning obviously. That's about it. Thank you so much.